Part 24, Toxin and Poison Exposure. Welcome to the lesson on toxin and poison exposure. In this video, we will discuss how to prevent careful situations of toxin and poison exposure. Toxin and poison exposure. The list of toxins and potential poison exposures is extensive and beyond the scope of this video and CPR handbook. A material safety data sheet, MSDS, is required where chemicals are in use in businesses and institutions. The data sheets provide information about the composition of various chemicals and are useful when contacting poison control. To provide first aid care toxin and poison exposure, first. Step 1, call 999/EMS. Step 2, ensure scene safety and wear personal protective equipment. Step 3, get the first aid kit and the AED. Remove the individual from the toxin or poison and seek a well-ventilated area if possible. Step 4, remove saturated clothing. Step 5, follow any recommendations from the 999 dispatcher or the MSDS sheet. Step 6, stay with a person until advanced help arrives. If its CPR is required, ensure a mask is used if possible. When treating any toxin and poison exposures, the eyes should be flushed with copious amounts of water. Acids and alkaline solutions are particularly caustic and can lead to permanent vision impairments or loss. This concludes our lesson on toxin and poison exposure. Next we will review Chapter 2 about choking treatment, starting with adult cardiopulmonary resuscitation, CPR.